Hey everyone, and welcome. If you're a nursing student, you know there are some skills that are just essential. NG tube care is one of them. It can seem a little intimidating at first, but don't worry. In this explainer, we're going to break it all down, step by step, so you can walk into that patient's room with total confidence.
All right, so here's our game plan. We'll start with the absolute basics, then move into prep, the procedure itself, what to do when things get tricky, and finally, how to wrap it all up with documentation. This way, you'll have a really solid framework in your head for both your exams and your clinicals.
So, first things first, what even is an NG tube? Well, it's pretty much what it sounds like. A soft, flexible tube that goes through the naso, or nose, and ends up in the gastric system, aka the stomach. Think of it like a two-way street. We can use it to pull stuff out, like gastric contents, or we can use it to put things in, like liquid nutrition or medications. It's a simple tool, but it's incredibly powerful.
Now, this is so much more than just a task you check off a list. This is where your nursing brain really kicks into high gear. You're responsible for making sure that tube is exactly where it needs to be, that it stays clear and working, and that your patient is handling it okay. It's about protecting their skin, educating them, and above all, keeping them safe and comfortable. This is the art and science of nursing, all in one procedure.
Okay, with the basics covered, let's get into our first big section, preparing for safe care. Because, honestly, a smooth procedure starts way before you even walk into the room. Think of this part as your pre-flight checklist. It's absolutely non-negotiable. You've got to check for allergies, you've got to use at least 2 ways to confirm you have the right patient, and of course you use your standard precautions in PPE. Oh, and here's a huge one for your exams. This skill cannot be delegated. This is a nursing judgment call, and it stays with the nurse.
All right, let's talk about your toolkit. This first batch of equipment is all about answering the single most important question: is this tube in the stomach? You'll use a syringe to pull back a sample, pH strips to test it, and other tools like a pen light. Each one gives you another clue to solve the puzzle and guarantee that patient's safety.
So, once you know you're in the right spot, your next job is to keep things running smoothly. This is your maintenance kit. You'll need supplies to flush the tube to keep it from clogging, and everything you need to secure it properly to the patient's nose, because the tube that's clean and secure is a tube that's safe and effective.
And now for the main event, the procedure itself. We're going to walk through this step by step, nice and slow, so you'll know exactly what to do when you're at the bedside. Let's do this.
The procedure always starts with your patient. Take a moment to check their chart. Pull the curtain for privacy. Introduce yourself. Building that rapport is so important. Then, after hand hygiene and PPE, you confirm who they are and just walk them through what you're about to do. A little bit of education can make a world of difference for their anxiety levels. Okay, here it is, the most critical step: verification. Notice we have multiple checks here. That's on purpose. It's all about creating layers of safety. You're checking the measurement mark on the outside, you're looking at the drainage coming out, and you're pulling back that sample to test it. Every single check is a safety net. And this right here, this is the magic number. You are looking for a pH of 5.5 or less. Why? Well, think about it. The stomach is basically a bag of acid designed to digest food. So if you're in the stomach, the contents should be highly acidic. A low pH like this is your best confirmation at the bedside that you're in the right place. So memorize this number. Seriously, burn it into your brain. It's your key to safety. Once you've confirmed placement, it's time to make sure the tube is working. You'll gently irrigate or flush the tube to keep it clear. But while you're doing that, you're also assessing. You're watching your patient. How are they doing? Any signs of nausea or bloating? You're constantly observing and talking with them. It's an ongoing process. Okay, but what about when things don't go as planned? Because let's be real, in nursing, you always have to be ready for the unexpected. This is where your critical thinking skills really come into play. This little guide is your best friend. Look, if your patient starts coughing, choking, or can't breathe, that's a code red situation. It could mean the tube has slipped into their airway. You need to get it out immediately. For a less dramatic problem, like not being able to get any fluid back, sometimes just having the patient roll onto their left side does the trick. The takeaway here is to recognize the problem, understand what it means, and act fast. All right, we are on the home stretch. You've done the procedure, but you are not done yet. These final steps are just as crucial as everything we've talked about so far.
Before you walk out that door, do a quick safety scan of the room. Call light? Check. Bed low and locked? Check. Their water, their phone, whatever they need within reach? Check. It takes 10 seconds, but this simple routine is huge for preventing falls and just making your patient feel cared for. And finally, documentation. You know the saying, if it wasn't charted, it wasn't done. Your note needs to paint a clear picture. What time did you do it? What did the aspirate look like? What was that all-important pH result? How did the patient handle it? Clear, accurate charting is your professional and legal responsibility.
So, as we wrap up, I want to leave you with this question. Think about it. This one skill, it's not just a task. It's a perfect blend of technical ability, sharp critical thinking, patient education, and compassion. In a way, it's everything that being a great nurse is all about. I really hope this explainer helped you feel more confident about mastering NG tube care. If you found it valuable, do me a favor and hit that like button, share it with a classmate, and subscribe to the channel. We've got a lot more nursing explainers coming your way to help you succeed. And hey, speaking of succeeding, if you're gearing up for the NCLEX, we've put together some awesome revision books that summarize everything you need to know. The links for those are right down in the description. Thanks so much for watching, and good luck out there. You're going to be amazing.